So are certain people more at risk for a pandemic flu?
I think in this case, people should make the assumption that we're all at risk. And of course, if it shows up, if we actually get a pandemic and we actually can track who's getting sick, we'll be able to better target it. But right now, we should assume that we're all at risk.
Often it's the people who are most active in the community, who are traveling around, who are going to be infected first. And so it might well not be older people and children. A lot of young adults who are active, business people, physicians, nurses, and others, if not properly protected, will be infected by this virus.
So if there was a pandemic flu, would they really quarantine entire areas?
Quarantining is separating those who've been exposed to the disease from those who you believe have not been exposed to the disease. Isolation is separating those individuals who have the disease from those who do not have the disease. Two other ways that people can separate is bad weather days or just staying at home. Bad weather days, we all experience those, are either snow days or rain days where you can't get to work. And therefore, the institution, whether it's a government agency or a business, more often schools and government agencies may be shut down for business because people can't get there. The other is staying at home. When either you don't feel well or, more importantly, you are worried about being exposed, you might voluntarily choose to stay home. Now, those are issues that schools, public sector organizations, and private sector organizations have to think about.
Would we need to go out and buy surgical masks?
Masks are really a controversial issue right now. There are surgical masks, there are N95 masks, also called respirators. And what everyone wants to really get across is that the masks may be helpful, but they are not going to be the answer. We've got to talk about washing hands.
Is there a vaccine for the pandemic flu?
There is no tried and tested vaccine for a pandemic, and almost by definition, because if you had a vaccine, if you could create immunity in people, it would be very hard to have a pandemic. So one thing that makes a pandemic is the fact that people don't have immunity, and you don't have people who've been adequately vaccinated.
The government is investing a lot of resources into vaccines and into vaccine research, and we are hoping for research breakthroughs here that really will provide us that vaccine. But if we just had to say today, is a vaccine readily available for pandemic flu, the answer is no.